afternoon, and welcome to the Childhood Trauma Learning Collaborative's listening session, Helping Families Navigate Child Therapy, with founder of Peace at Home Parenting Solutions, Ruth Ettenberg Freeman. Ruth will give a brief presentation about today's topic, followed by a discussion with the Childhood Trauma Learning Collaborative's director, Dr. Martha Staley. We will then open the floor for questions from the audience. I'd like to acknowledge the traditional, ancestral, unceded territory of the Nipmuc Nation, now known as Storrs, Connecticut, where Ruth is joining us from today, and the territory of the Mohegan Nation, now known as Columbia, Connecticut, where I am joining from. My name is Dana Asby, and I will be your webinar manager and host. Today's meeting will last approximately 1 hour. Microphones will be muted during the presentation. At designated times, for example, during our question and answer session, you can use the raise your hand feature to request an open mic. When speaking, be sure to eliminate background noise. You can also submit questions for Ruth throughout the presentation using the chat. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please send a private chat to Ingrid Paget, our technical support manager for today's webinar. We're pleased you joined the webinar, and now I'd like to introduce Ruth Freeman. She's a licensed clinical social worker in private practice and has taught parent education for the past 35 years. She is the co-founder of the Connecticut Parenting Education Network and founder and president of Peace at Home Parenting Solutions. Reminder that we use affirming, person-centered language on this webinar and all of our webinars, so please keep that in mind and keep your comments and questions respectful of all on the call. Thanks, Ruth.
So I should begin now, Dana, right? What Dana left out is that I'm a bio mom, stepmom, foster mom, and nana, and that's my claim to fame. I'm going to be talking to you today about a class that I teach for parents that grew out of my experience of working with parents about their children. Since I've been a parenting educator for 35 years, my practice is often centered around children, but I don't see them. I mostly work with parents and try to address child issues by addressing parent behaviors. And parents are often telling me about their children in therapy, and I had some thoughts about how things should go with that, having heard about it. So I'm going to be reviewing a class I do for parents. I'm going to zip through it. You know a lot of it, but some of it may be new to you. And I'm just letting you know how we help parents learn about this issue of navigating therapy for kids. And this is an outline of what the class will be talking about, which we would go over with parents. We emphasize that kids are unique, and so certain behaviors may be normal for one child, not for another. And when we're thinking about therapy, we're thinking about a disruption in behavior or emotions. And, maybe kids are having difficulty managing emotions or behavior. Maybe they've been distressed for more than a few weeks. Maybe we're seeing problems in more than one setting. And maybe their behaviors or feelings are getting in the way of their typical activities. And finally, when parents have made efforts to address these issues, they've talked with experts, things haven't gotten better, then finally, we're going to think about the child being in therapy. From my point of view, this is always the last resort, and we're helping parents think about what are some other options. But if we're going to talk about therapy for kids, we want to keep in mind that it can be challenging just to bring a child to therapy. The child might be uncomfortable, the parent might be uncomfortable. Parents can expect to feel more comfortable over time. And it's important to feel that the therapist listens well, understands the child's concerns and your concerns, and really has guidance to offer. And we emphasize to parents when they're thinking about therapy that the relationship between the therapist and the client, according to a lot of research, is the most important contributing factor. So if they don't feel comfortable with the child's therapist, or if the child doesn't feel comfortable with the therapist, that's a red flag. Typically, we're stopping classes for questions and comments, but I'm going to get through the content and then we can talk about it. And please don't hesitate to post questions as we're going along. So when parents are thinking about talking to kids about therapy, we encourage them to talk about it like, we've got a challenge here. You're blowing your top and hitting people and hurting things and people, and you don't want to do it, and we want to help you not do it, but we haven't been able to solve this problem. So we're going to go to an expert and get some help. We're going to learn together. I'm going to be a partner as your parent. I'm going to be a partner in this process. and we're going to think together about what's going to reach the goals that we share. This has nothing to do with punishment or that you're a problem in any way. When parents are starting with therapists, we want the parent to expect the therapist to tell them that everything that goes on in a session with the parent or the child is completely confidential to their family and won't be shared without the parent's consent. And the therapist should be explaining to the parent that if they feel there's any danger to the child emotionally or physically, they have to report that to authorities. Therapists should disclose this at the beginning. And with teenagers, therapists should be negotiating with the teenager and the parent what kind of content is going to be shared and when it's appropriate to keep some of that content private. And therapists should also be clear about the cost of treatment and payment and when that happens. All that should be explained at the beginning. One of the parents' biggest jobs in therapy, which is often overlooked in my experience, is for the parent to be part of the goal setting process in therapy. The parent should expect to come to the first session, sometimes without the child so they can speak freely, and bring a list of concerns. And as kids and the therapist are all on the same page about the specific goals. So parents have a very important role in therapy. Typically, I'm talking directly to parents, but I'm talking to you as colleagues right now. And the parent role should include, after 2 or 3 sessions, having a relatively in-depth conversation with the therapist and see what the therapist thinks about the problem and whether they really think they can help, the kind of treatment they're going to use, and how often the therapist wants to meet with the child and how often the therapist wants to meet with the family or the parents. And the therapist should be clear about what the parent should expect to be their role. And the therapist should be helping the parent recognize that being aggressive or chronically, oppositional or emotionally withdrawn are ways of coping, and they're not purposeful actions. Also expect that the therapy may focus on the parent's response to the child behavior. And this is often missing in child therapy from my point of view. Parents should expect that the therapist will be helping them reflect on how they understand the child behavior, and they should be considering the child's misbehavior or challenging behaviors as a kind of communication, and what is that communicating to the parent. And the parent should expect to reflect on their responses to kids' behavior. We can't all be perfectly prepared for every type of child, and we should expect to get some help on how to respond to this unique child, and the therapist should be aiding the parent with that. The therapist may also go as far with the parent as asking them to reflect on their own childhood, the parent's own childhood, to think about their relationship history as kids and as adults, and how it might be affecting how they're responding to their child, and consider that the child may be triggering them in some ways and bringing out the worst in them or the worst of their memories from childhood. And those of you who are therapists understand this. So parents often are wondering, I meet with parents in my office all the time, and I say, so what's happening in your kids' therapy and what are they working on? Parents don't know, and they don't know if they're seeing any progress, but they think the therapist is the expert and they should just keep going. So we often talk to parents about, how do you know if the therapy is working? First of all, it's important to feel that the therapist really gets you and the child and understands your concerns and values, listens to your points of view and the child feeling heard about their points of view. And the therapist should be offering help and hope for change and respects you and your family as well as the child, and engages with the parent regularly in the process, not seeing the child for months without talking to the parent. Hopefully, the parent is seeing the problems being reduced, some kind of progress, and the parent should expect to talk with the therapist and see how goals are being met. Is there some progress? What's happening? If the goals are met and the problem is no longer existing and not affecting the child's life, it may be time to end the therapy. You don't just keep going to therapy. It may be time to go a little longer so the child integrates these changes. And sometimes there may be new goals to identify. But if you've gotten to your goals and there's no other goals, you're done. That's the purpose of therapy, and that's the purpose of having goals. If you decide that the therapy isn't working as a parent, You really want to not give up on therapy or on the child's ability to change. There's a whole variety of therapists. You want to talk again with getting referrals and consider what parent support groups might be helpful. You want to talk with other therapists and think about other kinds of therapy. Maybe this child needs cognitive behavioral therapy. Maybe your whole family should be in therapy, but don't give up on the child and don't give up on therapy. So kids may need therapy if difficulties are lasting more than a few weeks. Parents want to look for therapists that are affecting and addressing the specific challenges. You want to hear from the therapist about how they're doing it and what their experiences of it. You want to ask a lot of questions and feel like questions are okay and that the therapist respects you and the child. You want to make sure that you're part of the goal setting process and the child is also, and that you know what the indicators of progress are and you're looking for it. Make sure that you know you may be part of the change process and be willing to do that. And if therapy isn't working, try another therapist or another kind of treatment. Don't give up on the child or the idea of therapy. Peace at Home Parenting is also in the process of creating trainings for therapists who treat children, because we find that there's a lot of therapists that aren't doing some of these things. And this training is going to include helping therapists to manage expectations. They're not going to end up with the ideal child, and therapy isn't going to be the fix the kid myth. The therapy is a resource, not a replacement for the parent. We're going to help therapists figure out how to engage parents as experts and as essential resources to the parents, and to use parents to access the child's experience and to acknowledge the change the parent wants to see, but clarifying what kind of possibilities are really there. We're going to help therapists support the positive parent-child relationship and actually teach child therapists, if they're not already doing it, to use genograms to identify with the parents intergenerational family patterns and issues and relationship patterns, and share some parent assessment tools with therapists. One of the things that we believe child therapists should always be doing are teaching parents essential knowledge and skills so that the parent-child communication and positive attachment is being built. Positive effective discipline is matching the child's needs and increasing cooperation, adjusting parent expectations to match child capacities and recognize what Ross Greene calls those lagging social emotional skills, which are so important for parents to understand. We especially want child therapists to be very effective at explaining developmental stages and what tasks kids have to do and how parents can help them, and strengthen parents' capacity to do self-regulation and co-regulation. We talk to parents about being their child's calm center. And we always want parents to recognize the power of playfulness in the relationship. All the way through adolescence, playfulness actually calms the brain. It also prepares the brain to learn, and parents are under so much stress, and we have so many parents with adverse childhood experiences that play often just isn't built into family life. So it's something we're really wanting therapists to teach parents, and it's what we teach parents in our classes. So for those of you who are thinking about what does the parent ask the therapist, what's your experience with this kind of problem? How do you expect us to be involved? Will you be meeting with us separately? Are you going to develop behavior or relationship plans for us to try at home? We will be asking the child to practice new skills and help us understand how therapy works and how it's going to work for our particular child. I think that's everything, and I'll be happy to answer some questions.
Thank you so much for that, Ruth. I mean, there's so much information that is so incredibly useful in what you've shared tonight, knowing that you, of course, do many long classes about these very topics, because this is such a complex issue for not only parents, but children. And Lisa in the chat brought up the fact that often children, parents work to find therapy for children when they've expressed feeling worthless or feeling hopeless or feeling depressed, rather than bad behavior. And I'm imagining that might change throughout sort of the developmental stages of the child. So I'm wondering if you might be able to talk a little bit about how the role of the parent and the relationship with the therapist might change from somebody a child who is 5 or 6 to 16.
Well, I just wanted to start with that example you gave, because I'll give a disclaimer. My bias is that I don't like to see kids go into therapy unnecessarily. And I always want the therapist to treat the parents first. So, for example, I had a couple come and see me whose daughter seemed anxious and kind of down. And so I just listened and did the genogram and everything. And at the end of that conversation, I realized that mom is a little OCD, and she was just a perfectionist. And she just would just do little corrections on this kid all day long. You know, the socks don't match, or her handwriting wasn't quite right. And, you know, mom had a little bit of an anxious background from where she grew up. And they were great parents. I mean, you know, they took the kids on wonderful adventures, and they were wonderful parents. There was just this little strain of perfectionism. And mom was a little anxious. Daughter was a little predisposed to anxiety. And when mom stopped, I said, you know, just ask yourself, is this essential? Does it matter if her socks match? Does it matter if her hair isn't combed? Just stop and let's do an experiment. So mother's anxiety went up when she wasn't able to constantly correct, and we noticed all that. But within 3 weeks, this kid's symptoms really diminished. So there's so many of that. But the question you asked, and do I need to share my screen differently, or is there something I'm supposed to be doing for some reason?
You can, I think you've stopped sharing your screen.
Yeah.
Yes. So you're all set.
Sorry. So I think that the issue of how the therapy is conducted is, of course, based on developmental stages, and the time where it gets really problematic is with adolescence. And actually, I promised Dana, who planned this with me, that if there were any questions I didn't think I could answer 100%, I was going to invite you all to join our private Facebook group at Peace at Home Parenting. It's actually Peace at Home Parenting Private Group on Facebook. And if you just put the name of this organization, you can put MHTTC or Mental Health Technology, whatever you come up with. We will allow you into that private group. And I'm going to ask one of our teachers, Denise Parent, who was a trainer at the University of Connecticut Marriage and Family Therapy Program. I want to hear what her thoughts are on this particular question, and I'm going to post it on that page. But I think that for school age kids, the therapist really has to think well about whether they want to keep secrets. If the child is starting to tell them things that they want kept secret from the parents, I think the therapist has to wonder, why is this being kept a secret? And has to treat that, and should be very careful about that. Obviously, if there's any risk and danger, you make an agreement, but you let the child know that you have to protect the child, and you're straight up with them about that. You don't surprise them about that. But with teenagers, I think that you have to define those categories. So you're going to say to the teenager, I would like to share with your parent any ways that they can be more supportive to you and the things that you need. And I would like us to all talk about that as a team. If you talk to me about your boyfriend, I'm not necessarily going to talk to your mom about that unless you're breaking rules or you're putting yourself at risk. So it's with the parent and the teenager negotiating these territories that are going to be shared and not going to be shared. And I think it's unique to each parent-child, combination.
That's really helpful. At least it gives us some idea about what we should be looking for working with a therapist, being responsive to some of those dynamics and seeing the child as being at the center of this process and surrounded by the family, right, as another important piece. Given that our project is really focused a lot on the role of school-based mental health and schools, and that sort of intervening role of, say, a school social worker or school psychologist who is not necessarily the primary therapist and is not the parent, but could you talk a little bit about what the role of that school-based professional might be in this relationship?
Well,
these relationships, rather.
Well, I'm not a school social worker. I actually did the training for it, and it looked really scary to me, so I didn't do it. but I do work a lot with school social workers, and they're from my understanding, their responsibility is to help the child do what they need to do in order to be able to be successful in school. Now, where one end and the other begins is such a tapestry. I think it's hard to draw a line. However, I think that one of the great things that school social workers do is they help children feel safe with the idea of talking to a neutral adult, and the school social worker can be the bridge to a therapist. The structure of school social work, where you've got the kid for 20 minutes and fix all the social skills, and it just seems very daunting to me. But I think that school social workers are great bridges to help kids. You and I work together, and we made progress on this, and I have a colleague who I think is going to be able to help you with that, and we can all work together. And I think that school social workers should expect therapists to reach out to them if they're involved with a child. And I think that child therapists should be very inclusive, talking to other caregivers, talking to child care providers, talking to school social workers, and knowing what are the goals of the school social worker, and making sure we're all on the same page, the parents, the therapists, and making reasonable expectations of the child, and pacing. And I just think that school social workers, and the other important thing that school social workers do is they help parents have language for children's behaviors and difficulties, and they help parents reframe that. And I hope that school social workers will use programs like ours, Peace at Home Parenting, where you say to the parent, she has very low self-confidence. She's struggling with confidence, and she may be a sensitive kid. So maybe you want to figure out some ways to talk about emotions with her that are encouraging. Or maybe you want to notice if there's a lot of criticism happening. Maybe you grew up with criticism. Maybe you don't even know it's happening. Maybe you're correcting yourself a lot. And find ways to talk about particularly those confidence and communication issues that parents are struggling with, and getting kind, neutral language. Actually, I saw one of your emails go by that was about talking to parents about child diagnoses, and I didn't catch it, but I would love to see it. You had an article, and maybe Dana knows where it is, about professionals learning to say, talk about what's obsessive compulsive disorder, talking in lay language that doesn't pathologize the child. And I think that's a big challenge, just talking about those.
That certainly comes up a lot in our discussions with in child mental health professionals, but also teachers, educators, and parents. Many of us are in dual or multiple roles, right? Like parents and professionals. Is this idea of stigma and schools being involved with the child's health or mental health? Like, are schools going to know, and is this going to be a problem for the child going through? And I wonder if you could talk a little bit about teasing out those fears, or how you recommend talking with parents about those particular fears about stigma.
There's a couple of things that I say to parents. One is that at certain ages, kids have these open windows for learning. So, you learn language from this age to this age, and you learn math and English and stuff from this age to this age. And during those open windows are the optimal times to learn. So if your child is having worries that distract them during school, and we could label that anxiety, but it doesn't really matter. If your child is having worries, whatever it's going to be called, he's going to have trouble focusing on school. So the open window is going to be not maximized. The learning won't be maximized because they'll be worrying during the open window. So let's see if we can address those worries so your child can get back on track to their job from 8 to 12, which is that open window for learning, mastery, and so forth. So it's helping parents understand the tasks of this developmental stage, and let's get the barriers out of the way. And I also talk to parents about adverse childhood experiences, which I'm sure most of you know about. And 2/3 of the general population has had at least one adverse childhood experience. Only 1/3 of us didn't have any, and I doubt that number. That seems too high to me. And they're so common that it's silly for parents to expect their children not to have the consequences of intergenerational ACEs. And I explain what adverse childhood experiences are, and it tends to make everybody more normal that we have these issues and we're all, going to work on them together.
Isis, I asked a question that is really related to that about working with victims of domestic violence. And, there's the school perspective. And I think that this is coming up a lot now, given the pandemic and the isolation that families and parents and children are experiencing. And also in cases where there is domestic violence, a lack of connection perhaps to a safe adult outside, but it also brings up the question about what do you do when you are a concerned adult or have a child who needs this sort of therapeutic support, but is living in a situation where there is domestic violence, or where the parents or one of the parents may be adversarial in some way.
Well, if someone is being physically or even psychologically harmed, we're required to get protective services involved, and we can't circle it. And it's imperfect and it's intrusive, and lots of us don't like to do it, but we can't avoid it. One of the things, I used to work for the Cove Center for Grieving Children, and one of the exercises we used to do were these, either you would make this design or you would make these little flowers or whatever, but you help the child and the parent in these cases create a circle of support. So it's literally, you do a visual of who are your people, and it could be the grocery store person, the guy who runs the grocery store who always gives my kid a slice of bologna. It could be, the child's nurse practitioner. It could be the neighbor next door, and talking with struggling parents and kids about their people and helping them really move towards those people in these situations and ask for help, even though there's so much shame and difficulties and so forth. Ask for help to stay safe. And I don't think that school social workers can facilitate this very well, but they have to get them to a support place. I actually have a handout about emotional abuse because it's so subtle. And I often encourage people that are in that situation to go to DV support groups to understand that psychological abuse or just emotional threats are just as crippling to the child and the parent.
Thank you. Is that something that, along with Isis's question, is that something that you in your parenting classes and resources address, that issue of abuse? And you said you had a handout, but
well, we have a class called I can't remember. The name isn't coming to me, but it's about self-care. And actually, Aetna Corporation asked me to create this class, and then once I did, I realized the value of it. And in this class, it's asking parents to look at themselves, and we share the symptoms of depression, anxiety, abusive relationships, and a few other diagnoses, saying to parents, look, you really can't parent effectively when you're not treated for these, when you're having these symptoms. Oh, and substance abuse and dual diagnosis particularly. And it's just a whole class on if you're feeling this, if you're feeling this, get some support and giving them some resources, because it's like the parent oxygen mask. If you're depressed and you're just white knuckling it, we have mirror neurons in our brains. Dana's an expert at this. If you're feeling depressed and you're acting cheerful, your child's brain picks up on the depression. And we have to address those things in ourselves. It's the oxygen mask first.
Thank you. I want to we're about halfway through our session. I want to open it up to the group if there are other questions. But before we did that, I was wondering if you could talk a bit about the role of culture in these relationships between therapists and parents and the family, and how parents can think about the role of cultural responsiveness and humility in this, or what they should be looking for.
Culture is I'm not an expert in this. I've done it in my practice, but I can't really speak to it as an expert, but I want to say that culture is a territory that requires the therapist to be very curious about the parent and to be checking in with the parent often. So, for example, our most basic premise is that we don't support corporal punishment in general based on a lot of research. However, there's exceptions to that too. And there was a researcher at UConn that went to St. Kitts Island and wrote about how when in a Caribbean community, when corporal punishment is used in a predictable way by calm parents for the same behaviors across all families, so it's homogeneous, everybody's doing it, they're spanking kids for the same reasons, and they're doing it not out of explosive anger, but just because that's what you do when the kid doesn't tell you the truth or whatever. They don't see the negative outcomes of corporal punishment. So even one of those things that I hold so dearly as a premise, I've got to listen to the parents and hear what they're saying about even corporal punishment. And I will share with them what the research tells us. But a lot of the research is based on Western European kids, so even as a parenting educator, we're always saying, this is what the research suggests. We want you to try this. Consider this. It's always a collaboration between the professional and the parent. And I'm often saying to the parent, when I recommend this, what comes up for you? What might your parent think about this? And sort of going back and forth. And there's so many different cultures in the United States that we just have to be curious. We can't know them. So we have to be curious. And we have to go across that divide of we're raising children to be successful in this culture, in the dominant culture, but at the same time, we want to hold on to the traditional culture. And what does that look like? And the parent has to make the final decision. Like in Puerto Rican families that I've worked with in Willimantic here, the feeling of protecting the family and devoting ourselves to the family and the elders and the mothers do so much for the young children, and kids don't go away to college because they want to stay with their family and stay connected. We have to talk about that, because honestly, that family-centric perspective is fabulous in a lot of ways. And I would often look at them, and when my kid was little, I was thinking, I wish I was teaching my kid to be that devoted to family, because I was raising my child to be sort of a Western European, successful, independent, and we just have to talk to parents and say, so if you do all this for your 5 and 6 year old, when they get to kindergarten, they're going to have a little harder time. But at the same time, they're going to be attached in a different way. So we have to keep going across the divide of what the research tells us, which is, predominantly Western European, and what their goals are in this culture, and work together with the family. Because I don't think there's any straight up answers about this. Does that make sense?
It does. And I really appreciate the perspective that going into this with curiosity, right? And also some, as the therapist, awareness of your own cultural biases, right? Like, well, the culture that I come from does this, but this family is doing this, and constantly questioning and going back and forth makes a lot of sense. I want to open it up to questions from our audience for Ruth, if you have them. I mean, I myself have about 1,000 more questions, but I'm hoping that some of you have some maybe questions that brought you into this session, or concerns, or situations that you're trying to navigate now. And I'm not sure in our audience how many of you are mental health providers or school professionals, and how many are coming as parents who are looking for information. Yes, raise your hand or type a question in the chat if you have one for Ruth.
Dana,
If-
while we're waiting for questions, I just want to mention that tonight I'm going to be on Facebook, our public page, Peace at Home Parenting on Facebook, with Erin Weintraub, our special education expert, and Cora Megan, our early childhood person. And we're going to be talking about positive discipline for kids 2 to 12. And it's a live Facebook event, and people can just come to Peace at Home Parenting in our public page, and they can ask questions, or just send parents and they can ask questions, and we'll be talking about discipline.
That's fantastic. That's available to anybody?
Yes, it's public. It's open to the public.
Wonderful. Let's see, from Lisa, some kids need to go to therapy intermittently, especially during changes, not just once. How do you talk about that? I'm guessing, Lisa, how do you talk about that with the child, or how do you talk about that with the parent? Maybe you could talk about both of those perspectives.
So from my point of view, therapy is a problem-solving process. So, you know, I often say to parents, you know, you can say to your child, look, you know, you're having trouble seeing your friends. You're staying in your room and you don't want to go out, and you're not seeing anyone in person. I think you know, the pandemic is really bringing some social anxiety stuff out all over the place. So, you know, you were on the hockey team. People determined that playing hockey is not going to be dangerous. I don't know if this is true. I'm giving an example. And you're feeling a little scared to go to the hockey game. And a lot of kids are feeling scared of germs. And that's happening for many kids and adults. So if you can get to your hockey game and feel okay, that's great. Otherwise, let's have a little consult with your therapist, because you talked to him last year and it really super helped, and see if we can get some ideas about what's going to help you to get back to hockey. So I would be inclined to just solve problems, you know, and talk about it in that sense. And I would always start with the kid, and I would say, do you have any ideas about what you can do to get yourself to hockey without feeling too anxious? Because sometimes kids have solutions. Or you can say, I remember he talked about this exercise. Is that going to be helpful? And you do sort of a conversation problem solving. Maybe it's seeing the therapist. Maybe it's going back to a CBT strategy. Maybe it's talking to the coach online. Maybe it's talking to grandpa about this. Let's look at some solutions. One of which is that you can talk to your therapist. I just don't like when parents are knee jerk. You have to go back to therapy because you're anxious again.
That sort of gets to another question that I had that's related. You mentioned not giving up on the child and not giving up on therapy, but often you'll come across kids in various situations who are saying, I don't want to do this. I don't want to go to therapy. I'm not going to do it. And I certainly have heard a lot of stories about kids when they get older, maybe as teenagers, just saying, okay, well, then I'm not going to talk. Or when they're little, not being willing to talk to the therapist. So could you talk a little bit about how you know when to push and how to push that, and when to step back and say, okay, to respect the child's autonomy?
Well, one thing to keep in mind is that, particularly with young children, therapy isn't necessarily talking. So it might be sand play. It might be playing with dolls and objects. It might be playing Monopoly and the kid just talks while they're playing Monopoly. I remember I was working in the predecessor to Connecticut Children's Hospital, Newington Children's Hospital, in the psychiatric unit. And this little 4-year-old boy, I asked him to draw his family. His father had done incredible domestic violence to the mother. The mother could never break up with him. And this child was inpatient at 4 years old. And I asked him to draw a picture of his family. He drew a picture of his family. He tore off the father. He walked across the room and put the father under a chair, and he showed me the picture without the father torn off. The kid had the whole family therapy handled, and that was just drawing. So it isn't always talking. And it's important that you find a therapist that matches your child. So you can say to your child, you know what, you don't have to talk to this person, but we're here to solve these problems. And if this person can help you solve the problem, we'll find somebody who can. Don't worry about it. And, you know, do your best. Let's go 3 times. Here's the deal. Let's go 3 times. I had a mother buy her kid ice cream whenever he interacted with the therapist during the session, if he actually spoke. And, it doesn't sound, it's not really great to use food that way, but she got the thing going. I don't recommend that method, but, parents are resourceful. And I'm going to tell you something. Bruce Perry, who's my hero, and I hope you'll put this in the chat. He wrote a book called Born for Love. Watch Bruce Perry, anything he does. He's on the internet. Watch anything he does. I think he's brilliant. He told the story of trying to analyze which therapists were effective in a particular therapy center. And he was trying to look at, the therapy approaches, the genders, the problems that the kids had. He couldn't figure out why were certain therapies successful and not others. Why were some kids succeeding in therapy and not others? And he said he was up at 2:00 in the morning looking at all the data, and he just stuck in zip codes into the data. And what he found was that the kids who lived the farthest away from the therapy center had the best outcomes. And what he discovered in looking at this, which really surprised him, was that the parents were talking with the kids while they were driving to therapy. And so those parent-child conversations were the healing element. So this is why I often say, I want to work with the parents first before we even bring the kids into therapy, and diagnose the parents and look at their family histories and listen carefully to how they're handling communication. One of the first things I ask parents is, tell me about a typical routine, what the routines are in the family, what the meals are like, what the expectations are like, what kind of discipline they use. I want all that done before we bring a kid into a therapist's office. But not all therapists are prepared to do that.
One of our participants from Maine says that he or she calls it car therapy, which if you've parented teenagers, that's where you get all of the really good information, right? And all of the good that. And if it's littler kids, it's right before bed.
Yep.
That you're putting them to bed.
Yep.
But Sean and Maddie both asked a question that is sort of related about the engagement of working with and keeping families engaged. Or Sean asked how to help when a child that you're working with is feeling that there's nothing that they need to work on and they're not open to recognizing the process. And I suppose that sort of holds for parents too. Like, there's no problem, there's nothing to solve here. How, as the therapist, do you?
Well, if the parent doesn't think there's a problem, if the child doesn't think there's a problem, they're not going to be in your office. But if, say, you're a school social worker and you see a glaring problem and everybody's saying there is no problem, if from that angle, I like Ross Green's material where he has this thing called digging down, he calls it, but it's a way of describing the problem without judgment or blame or shame, and just saying, well, it sounds like you don't think there's a problem, your parents don't think there's a problem, and right now you're skipping about half your classes. So the problem probably won't show up until all your friends are graduating and you're still stuck in high school. That might be a problem. Also, I'm concerned about what you're doing when you're not in class. Very often kids get into problems when they're not in class, they get into trouble. So that's how I see you not going to classes, missing half your classes. I feel worried about how sad you're going to feel at graduation. And I feel worried about what's happening for you when you're not in class. I wonder how you see not being in class. How do you see that? And sort of together sorting out what we're describing in a neutral, non-blameful way, asking the parents how they see it. The bottom line is, if the parent and child can't be inspired to see a challenge, I don't think there's any magic to, other than an honest I statement and describing things without blame or shame.
That makes a lot of sense. We just had a seconding of Ross Green, Collaboration and Proactive Solutions, from Vanessa. Maddie asks a question about suggestions for families who recognize the problem but won't commit to therapies for whatever reason.
So in some ways that's recognizing the problem, but not acknowledging the importance of it, and or fear about therapy. So, and even the word therapy, it's just so, I don't know, it's not a nice word. Um, so, one of the things we do at Peace at Home Parenting that we challenge ourselves to do is to talk in normal language. All of our education gets in the way, and we try to avoid all jargon, all jargon. So, we might talk about, here's the problem. Your kids are coming into school with black and blues because they're so aggressive with each other. There's so much physical aggression going on at home between them, we hope. That they're coming into black and blues, and the chances are that they're going to take that aggression into other parts of their lives in the future. So we're a little worried about their ability to focus or to make friends, or we notice that they're alone a lot of the day. Just try to talk about it without the diagnosis, without the and this is a challenge, and we think that this person who would be willing to see you as a family, or be willing to see your child and then you as a family, could really help with this tendency to want to be alone. Because we know that by the time your child is a teenager, she really has to have some friends in order to launch. We know that friends are what help us launch and be successful in life. So we're just a little worried about all this loneliness she's having right now. And we know some people that can help. Trying to talk about it before you get that therapy word and like that. And also exploring the barriers. Help me understand what you think of when we say this clinical social worker. What comes up for you when you imagine a clinical social worker? Do you have any experience with that? What's your impression? Help me understand it. And this, in a lot of ways, is the Russ Green stuff. Let's look at this from your perception, my perception, and dig down into the barriers and stuff. The other thing I often encourage people when they're making referrals to do is use motivational interviewing. How likely is it that you're actually going to make this phone call? What might get, if it's a 5, what's going to get it up to a 6? What would make it a 6? How committed are you to making this phone call? And just use some of those basics in making the referrals. And what can I do to help? Lots of times parents have the same symptoms as their kids, and they're terrified of being revealed. And that's something that we really have to talk about and be on their side about, and say, I get that this could be unnerving, but it could be better. Things could be better. You don't have to be worried a lot. Except in a pandemic, then that just makes sense.
Well, really the idea of therapy or that sort of relationship has really changed throughout this pandemic experience, right? So I wonder if you could just take a couple moments to talk about how this changes when you're trying to seek help for and develop relationships using a telehealth platform.
Well, actually,
if it does.
Well, colleagues of mine are telling me that teenagers love it, that it's going great with teenagers, and they're pulling their hair out with little kids because there's so much play therapy and it's really hard. And but the other thing, I think that everyone's getting used to telehealth. Those people that are in a socioeconomic situation where they have internet and they have technology, I think they're getting used to not just telehealth, but they're getting used to relationships that are electronic. They're having Zoom Thanksgivings, but I think one of the challenges for professionals is to recognize that a lot of what's happening for kids and parents is normal. And the feeling down, the not wanting to leave their room, all that stuff is relatively normal. And so when do we think about therapy for this? And in my mind, it's when it gets in the way of something. So if our guy isn't going to go to the hockey team that he used to love, then we've got a barrier or something. But if he's more isolating and he's not socializing with his siblings as much, he's not coming out of his room as much, that in itself is just a symptom. And we can, and I encourage parents of teenagers to have an agreement. You've got to have one meal a day with the family. You have to be outdoors for 30 minutes. You have to whatever, and you've got to have 2 hours of no screens or whatever it is. And that's what you need in order to earn your technology time. And you negotiate this with the kid, and even with school age kids, whatever it is, whatever you come to, and you just keep that, here's the deal. So you can do your game, because they're socializing through games. They're having, and we have to make there's no such thing as screen time anymore. It's how do we manage this? But negotiating and having clear boundaries and having clear routines. Families need routines, and they're having a lot of trouble keeping them, and they're more important than ever.
That makes a lot of sense. Having that predictability, right? And the boundaries on things where we used to, because we were outside and doing things. We were in school that had a set schedule, right?
Exactly it. That predictability is what's related to the anxiety, the increasing withdrawal, because there isn't the predictability. Last week we were in school. This week we're home. We go to school on Tuesdays and Thursdays. We're home on Monday, Wednesday. There isn't predictability, not at work, not here. And so routines and agreements and seeing symptoms in kids is predictable. I just saw an article that said the pandemic for some kids is going to be an example of an adverse childhood experience. And it's going to have some of the same impact.
We're hearing not a lot in our work that kids are really struggling with that, and families as well. We have an interesting question from Kasia. What would your advice be for a teenager if his or her parent is very negative or has a very negative point of view on most things in life? So advice for a teenager.
So the first thing I always want to do with teenagers, and I don't do therapy with teenagers a lot because I think it's really hard, but I love it when I do, but it's like entering the twilight zone for me. But the thing with teenagers is I always want to start with them. So I'm going to say to the teenager, how do you think you should handle your parents' negativity? What do you think might be helpful? And brainstorm with them. And, we teach parents a problem solving coaching process. So it starts with understanding the problem according to the kid, reflecting the child's emotions, inviting the child to brainstorm, inviting the child to consider each option and what might happen if they tried that, and then inviting them to choose one. So I would do all that. I would say, it sounds like you really feel discouraged about your parents' negativity. Do you have any ideas about how you might handle it? Have you ever done anything that actually helped? You might list some things. Any other ideas? Can you make up some wild ideas? Then go through each idea. What do you think will happen if you do this, do that? You want to try one of those, like that. I would also be really curious about how the child responds to the parent's negativity. I would talk about mirror neurons. I would talk about how when someone's really down, our brain starts to go down. And I would brainstorm with the child, what can you do when your brain starts to be affected by other, and it's not your downness, it's their downness, and teach them some CBT stuff and teach them some self-care and mindfulness stuff. And I would I'd listen really carefully about how it affects the child's thinking, how it affects the child's body. I would just listen really carefully to their internal experience of it, what they tell themselves when the parents are being negative. And I would also do a little therapy in thinking about, when did you first start noticing the negativity? What feelings did you have? And what did you tell yourself about yourself or about the world when your parents were being negative? You're looking for the decisions they made in the face of this, because it's affecting them all the time, and seeing if you can influence those decisions. So I would do all that stuff. And I would also, after all that, and that could take a few sessions really, if you do it all carefully, I would ask them, do you want to have a conversation with your parents? You want to bring your parents and talk about this? It's probably not going to make a big difference, but we could try. And I would also give them, after all that, I would give them strategies for, removing themselves, for doing a brain calming practice, for journaling. I would give them strategies if they didn't come up with some of those. How do we protect ourselves from down people? Because they will bring your brain and body down, And also, I would ask them why they think their parents are down, and what do they know about their parents' childhood that might be causing this. And I would ask them, I would invite the teenager, ask her to, ask your parents, how does that go? Ask them, what causes you to feel so down? Help me understand why you seem down. All those possibilities.
That is such a wonderful response. I'm imagining being a teenager who is in a situation like that and having a caring adult reflect that type of experience, and how validating and compassionate that would be. We are running out of time. I think we could, these are wonderful questions, all of you. So we'll just take one last question for now from Isis about any suggestion on approaches to parents as a young adult therapist trying to help them to navigate the child therapy.
The therapist as a young adult?
I think that that's what she means, the therapist as a young adult.
Actually, if you email me, my email is info@peaceathomeparenting.com. I actually have a handout for parent educators who are young adults without kids, and how to explain how you still have something to offer. And I think that, as a young adult therapist, you're talking about what you know from working with other families. This is what other families tell us work. Parents tell me this works. You use other parents as your experts. And this is what research is indicating. And why don't you give it a try and you let me know how it works? So, you don't have to say, you have kids or whatever. It doesn't, And if you're working with parents of young adults, that's a whole other world, because that's really challenging. And remember that adolescent brain changes go from 12 to 24. The brain changes are still happening. So
Isis, I bet you didn't realize that Ruth was going to have a handout that was already prepared on this topic. This is how experienced she is. And I think that this is a really great place to end. But Ruth, what is the one book that all parents should read in order to be a better parent?
Parents should read.
Yeah.
All right.
What's the one book that you would recommend that parents should read in order? That's a very difficult question. But
I think a lot of stuff by Dan Siegel. Well, oh God, Dan Siegel's book, Parenting from the Inside Out, talks to parents about their childhood and how it affects you as a parent. I mean, I think that's very valuable, but parents don't have time to read. So, email me if you want some ideas. I don't talk about books anymore, but yes.
Or maybe audiobooks.
Yeah, you can listen to it. Dan Siegel is fabulous, but Bruce Perry, Born for Love, Understanding Attachment. Oh my God, beautiful. But they're all dense, and only professionals really dig in.
The world of children's mental health, parenting, and therapy is pretty dense.
So
I'm appreciative that you were able to boil it down to a couple of key resources, and we are at the end of our hour together. But I just want to say,
let me just say, Jane Nelson is wonderful too.
Jane Nelson. Okay, we can write that out. We can send that to everybody in our follow-up materials. I just want to say thank you from the bottom of my heart, Ruth, for this information and for being so generous with your time and your resources and your perspective, which I feel like every time I talk to you, I learn a tremendous amount about being a better carer for children and being a better parent. And some insight into my own parents. So thank you very much. And I'm going to turn it back over to Dana.
It's been a pleasure. Thank you.
Yes, thank you so much, Ruth. And again, Ruth's organization is Peace at Home Parenting, and you can find them on the web at peaceathomeparenting.com. And we really thank you for joining us today. We want to acknowledge that our funding comes from SAMHSA, and that we have 2 Childhood Trauma Learning Collaborative listening sessions coming up. Our next one is February 11th at 4 p.m. and it's with Ann Smith. The topic is It Takes a Village, Optimizing Systems for Optimal Child Wellbeing. And on March 10th, we are going to be meeting with Meeta Gandhi, who will talk about mobile crisis teams and family engagement. So please do stay posted to the New England MHTTC's website for those events. You can also subscribe to our monthly e-newsletter. We just released the latest volume of Compassion Action, which was on community wellness. So visit the Center for Educational Improvement's website or the New England MHTTC's Childhood Trauma Learning Collaborative webpage to subscribe. And we are going to be sending you an invitation to join our Basecamp platform. Ruth had mentioned an article during her presentation today that she received because she's a Basecamp member. We share a variety of resources on a wide range of topics about youth mental health. So please do look out for that invitation in your email. And if you have any further questions about the MHTTC, please contact us. You'll see Martha's email address there, and we will be following up with you with a link to the recording for today's session. And don't hesitate to reach out. Thank you so much for being here. Bye.